Hello everyone, I am Piyush from Confesco, an international conference and exhibition company with focus on business transformation and operational excellence for our audience to explore organizational changes and business disruption. Today we have gathered here to bring you an exciting first chapter for our healthcare webinar series with the topic Healthcare Analytics and Business Intelligence. Our speaker for the session, Mr. Abdullah Saleh, is Group CIO, Omni Hospitals, having almost 27 plus years of experience in healthcare IT domain. He is a senior healthcare information technology leader with strategic and tactical planning experience. Large systems development, systems integration, and clinical transformation are his forte. Recently, for his exemplary digital transformation projects, he was also awarded with the CIO 100 Award that globally celebrates excellence in enterprise IT with a history of originating in the United States. So, without further ado, allow me to welcome Mr. Abdullah. Sir, the stage is all yours. Over to you.
Thank you, Piyush, for a quick intro, and we'll start straight away a quick presentation, and then we will take the questions answer session if there is any questions. So I'll be talking about healthcare analytics and business intelligence and its why it's important and why the healthcare organization is geared up to take this technology ahead, and what is the benefits and how it is going to add value to the customer. Customer means in health the patient, and the healthcare organizations who provide and deliver the healthcare services. So quickly, healthcare analytics, business intelligence means utilizing data analytics to make informed decision, predict the trends of the business in terms of non-clinical and in terms of clinical to predict the trends of the diagnosis, and then enable the treatment protocol automatically based on the diagnosis, whether it is provisional or final diagnosis. So, and which enables the quality care delivery and operational efficiency. So this tool is going to be help the adoption of the clinicians and clinical users perspective, to ensure that the clinically data is being consolidated during the stay of the patient inside the hospital as an inpatient, or primary care as an outpatient. So the first question comes to why it is required. So there are several reasons, but I have emphasized few of them. It is data-driven decision making at the point of care for the care clinician, improve patient outcome, cost reduction and operational efficiency. Cost reduction means it avoids the hospital to emphasize the patients to do the repeat service, to repeat the service in terms of diagnosis, if the data is being consolidated. And population health management, definitely the large scale of data is being collated, and there this business intelligence is going to work in terms of the clinician dashboard to make more easier. Revenue cycle management, if the data, if the patients are connected continuously with the hospital, with the healthcare providers, the care continuity will be enabled, and that is what the hospital looks forward to improve their revenue cycle management. And then quality improvement initiatives. If the clinicians, a particular clinicians is treating a set of people, then the analytics can give that whether the graph of the treatment is going towards deficit or it improving. Then regulatory compliances will be there. Fraud deductions and prevention, and definitely this data is the analytics is going to help to protect the data in terms of data sharing, in terms of data sharing from one organization to another organization. Patient engagement and satisfaction. Clinically, if the patient is if you're talking about the patient engagement and satisfaction, if the data is not digitized, and then it is impossible to ensure that the business is intact. Clinical research and development, it is enable the clinical data consolidation, and then perform a clinical research on that in terms of, given a very simple example, if the hospital want to look at that, which diagnosis from which part of the country the patients are coming, and then what is the further investment is supposed to do to improve the revenue, to improve the top line. And then supply chain management, again, the supply chain management is going to help the clinical healthcare BI in which is the right supplier who is going to supply the medicines in terms of pharmacy store, or which is the supplier is going to supply with the best rate for the general store items. There it works. And then finally, it helps the reducing the clinical errors. If the data are not digitized and the clinician is trying to treat the patient, then the clinical errors happens unknowingly in manual environment, whereby this component of IoT is going to ensure that clinical errors are minimum level, or it's a zero clinical errors, because at the point of care, this clinical decision support system will pop up to the patient and to the HCPs in terms of the interaction, in terms of the clinical interactions, in terms of the patient education. And then in the continuation of this, the reports from the experts said, they say that data complexity is typical high to healthcare system. That's why this component of IoT is important to adopt. And then the medical center effectively hold 1 TB plus data. So 1 TB, the minimum of a small hospital, if you're talking about the chain of hospital, maybe even 100,000 TB data. So there to run the analytics and to run the BI in terms of decision reporting, or in terms of clinical pathway enabling at point of care. So this component definitely helps a lot, and it makes ease of use to the doctors to avoid the too much of data entry at the time of completing the OPD prescription or inpatient as a case sheet. Will grow 60 times. Comes in 2025. I'll talk in the later why it is it means the market footprint and market requirement, the kind of the current trend, whatever we are looking, that entire industry, not only the healthcare, but other than healthcare, the analytics BI is being adopted on a large scale, but in healthcare it will be 60 times more by reaching 2025. BI strategy becomes a critical flaw if not planned properly. It means if any application which is going to be taken, if the BI is not there in that application inbuilt, then the hospital will not be able to achieve the final goal in terms of the quality healthcare delivery, or the patient experience, or the patient engagement in terms of continuity of care. So healthcare data capturing platform to run the analytics I'm just giving a quick a platform that what are the area that the data consolidation happen to to run the analytics are during this data consolidation in the runtime the analytics happen and give an outcome to the clinical users, clinicians, nurses, doctors, paramedical staff. So enterprise application, clinical and non-clinical, is supposed to be there. Sensor-based technique like beacons. So it's there are some devices which works on the sensor that also will be integrated with the clinical enterprise solutions to collect the data. Mobile devices, again the data can be entered by the patient, by the doctor on the mobile devices, and which should be a gadget, which will be a gadget independence. And the wearable devices will be automatically connected to the patient patient application, and from there the data automatically will be flowing back into the enterprise application. Medical equipment which will be there in the hospital, lab equipment, let's say radiology, all the imaging equipments will be connected, and there will be all the image and the textual reports and clinical parameters will be sent to the enterprise solution. And then data exchange, whenever we are doing the data exchange from one hospital to another hospital, and then in terms of inbound messages, and then taking the data from other hospital to our hospital means in that case also this data exchange will add a lot of value to collect and the entire data of the patient. On these are the sources where the data will be collected for the hospitals to enable the quality healthcare at the point of care, whether it is tertiary care, primary care, or secondary care. So the next, I would like to emphasize a bit why to data consolidate for having robust healthcare analytics. So whenever we do if you want to run the analytics efficiently, then we have the application in place which should be enabling the data capturing and proper data capturing, and then provisioning of data where that's automatically the application will do that, and then on top of it the data analysis and generating the actionable information on top of it, and the distributing the information to the stakeholders. Stakeholders may be the patient, maybe the other hospital, or it will be sharing the data from applications to the embedded system. The next is the generating actionable information with analytics. The biggest outcome from the analytics is what is the actionable is producing this technique. So it should be predictive, it should be proactive, it should be preventive, and it should be personalized. If you are talking about the predictive, then the trend likely to develop in the communities. Determine the proactive means determine the population at risk and spread awareness. So the analytics is going to give a kind of output. The preventive means actions to be taken especially for the life-threatening diseases and epidemics. So there also that if the data set of is there, then the healthcare providers can take the preventive action well in advance to save to put the safeguard on the patient fatality. Personalized means offering the best services and facilities to the individuals. It is self-explanatory. So this is a kind of actionable the analytics gives to the hospital and ultimately, if these actionables are being taken care of, then the hospital performance in terms of top line, bottom line, EBITDA, patient experiences and satisfaction, continuity of care, definitely will be enabled in a easy perspective. How business intelligence is transforming healthcare. So physician-led data insights. So the in business intelligence cannot work on unstructured data. Now, what are the big challenges? If we talk about 5 years ago, 10 years ago, the data are there, but those data are not stored in a logical parameters perspective. So on top of it, running that intelligence, the expected outcome definitely is not going to come. If any hospital is saying that I'm digitized and the clinicians are not using the application, then the data quality will not be as good as it's supposed to be to get the best outcome in terms of business intelligence component running on top of it. So it should be physician led. Physician supposed to be taking the using the application, getting the notifications, and taking the action on top of it to treat the patient. Accelerate drug discovery. This is again a huge emphasis and huge market is enabled for the drug discovery perspective on the patient trial chapters and patient who are connected directly to the hospital. So the data is directly flowing from the hospital to the pharmaceutical organization during the trial phase. There the business intelligence works very seamlessly, and it is required to have an accurate and faster actionable to park the outcome of any kind of trial in pharmaceutical industry. Then advanced data sharing, embedded data in care plans. So business if you're talking about embedded data in care plans, if any clinical pathway for a particular specialty, if a doctor put the sign, symptom, provisional diagnosis or final diagnosis, then the clinical pathway enables automatically that what are the services, what are the tests the patient is supposed to go, what are the drugs he's supposed to go, and what are the patient education he's supposed to know about it. And then the doctors just say that he can speak, say that, okay, review after 10 days or 20 days, automatically will come into that final impression, and he can say, he can modify the 10 days, 20 days based on the encounter and the clinical encounter and episode of the patient. Then data storytelling in research. Again, part of the research where the business intelligence and business analytics, predictive analytics data is going to be play a major role to get the better outcome of this component. Predictive healthcare with AI and machine learning is a part of this. I have just given a very good example that if I'll give a very good example here. If a patient is coming to the hospital, and a set of patient is coming to the hospital, and they have a doctor is treating to a diabetes mellitus type 2 patient, then which medicine he has order maximum to his earlier patient in based on that history, automatically those medicine as an order set will be on the top, because the result of that the doctor has prescribed that medicine in continuous basis, because patients are getting better result on that medicine. That's why that order set is on the top, so that the machine learns on its own, and then prompt to the doctors to select those drugs, or enable the services to the patients to go for. And I'll give another example, that the AI and machine learning perspective, AI perspective, if a patient is diagnosed with a head and neck cancer, and he has been diagnosed as a stage 3 kind of cancer, then in that case, system will automatically guide to the patient, the doctor, that the patient should go for a chemotherapy before the surgery, or patient should go for a chemotherapy for post surgery, and what would be the interval of that chemo, and what are the drugs is supposed to be as administered, and what dosage. Everything will come automatically, and where it is very tough and for the clinical doctors to calculate this complex calculation and ratio of the drugs manually. So on that front, in healthcare, that it's predictive analytics and AI works much better. The healthcare sector is ready for a healthcare dose of BI. Healthcare sector is drastically adopting this. And if any application which is being developed, application means I'm talking about EMR or EHR, if the business intelligence is not embedded at the maximum level, then the clinicians will not accept that, because there's to have a success data consolidation, the solution is supposed to be adopted by the clinical users, and if the clinical users are not using it, then BI will not work at all, and the healthcare organization in terms of users or in terms of organization will not get the expected outcome. So, and the way the healthcare booming in terms of adopting the digital transformation and the clinical transformation is huge across the globe. Though the US is on the top to adopting the digitization by 60 to 65%, whereas India maybe 10 to 12%. If we talk about the real-time EMR, the Indian hospital has adopted. But the way the Indian hospitals are coming up, and the offering and the product offering, Indian-based organization, health product organization has put in, I hope that down the line, the most of the hospital, at least the corporate hospital, is going to adopt it, and the data inter-exchange also will be achieved to mitigate the bottlenecks. As I said, that the BI and healthcare analysis tools, but put healthcare data in the hands of those that needs in the most, the physicians, nurses, researchers, and healthcare operations staff, to add the front line of the patient care. Without BI delivering the quality healthcare, it is impossible. Without BI, the clinician will not adopt the application, because any kind of clinicians are not ready to enter too much of data. They say that clinicians are saying that if we are able to create the prescription, OPD prescription in 3 minutes, the system should take less time than that. And on that front, a couple of product has been come up in India and well accepted by the healthcare organization and the clinical users. What are the benefits? It's improved business bottom line, definitely. better patient experience. Better patient experience means that hospital does not emphasize to do the repeat test, enable data access in the centralized platform. As I said that the clinical EMR EHR is nothing but a clinical decision support system. So clinical decision support system at the during the doctor and patient interactions, it's important, and unless this centralized data is not there, it's not possible. Provide operational excellency with actionable, enable personalized treatment plan. If we are saying that a doctor says that, boss, I want my clinical pathway or clinical protocol, all the drugs which are cost effective, no matter how, no matter if it is taking a little more time to recover the patient, I'm fine with that, because my patients are coming from the lower middle class family. They cannot afford the costly medicine, because those costly medicine give the result in, let's say, 1 week, and this lesser cost medicine give the results in 2 weeks, which is fine for me. Or the other way around, that if the system should, based on the patient who has come to need the doctor, the system should prompt the end users based on the patient condition, because it has been recorded at the time of registration that patient is a service and he lives in that locality. Based on the system understand, sense that patient is a lower middle class family, so based on that the drug will be ordered to prompt to the doctor to order that drugs. Reduce operational cost. If everything is digitized, definitely operational cost will be much cost effective. There is a department called MRD which takes care of a patient file. That department is not required at all, and that department, and let's say 4 people are working, and 4 people are working in three shift, maybe minimum 4 people. So 4 people, and then the huge place has been taken. If we're going to calculate the cost, is the cost effective, that is not required if the AI based EMR and EHR has been deployed. Improve patient experience. It is again improve patient experience in the sense, obviously, if at the time of treating the patient, and the data repository is there, and on top of it BI is working with evidence-based guidelines, then patient experience of course will be improved. Avoid redundancy means you don't need to go for a repetitive test without any reason, without requirement clinically. Runtime CDSS at point of care, it enables runtime CDSS at CDSS means clinical decision support at the treating the patient in terms of emergency care, primary care, secondary care, tertiary care. Predictive analytics for early intervention. I will say that clinically BI will predict based on the habits, based on the vitals, based on the past patient data, that what is the a kind of a prediction, and maybe some risk will be predicted, and doctor may take a note of it, and then start taking the prevention and start prescribing the medicine, or educating the patient to be prevented. Adherence to evidence-based practice, proactive risk management, market sizing and forecasting. This is again on the clinical side and non-clinical side, both sides. It is going to enable to give the which area the hospital is supposed to do a better business, and what are the investment supposed to be made to have a better footprint to improve the top line and bottom line financially. Competition analyst. Again, if you have a data, then you can see that each hospital performs the competition, and every business is there the competition. So that you have a data and you know that X hospital doing much better, and then you are not able to do that. So you can just look at what data you have and what is the reason clinically why the people are not coming, and clinically the people are coming, but why they have not revisited again. That kind of analysis do, and then take the preventive action towards the improving the business. Market entry and feasibility studies it says that which area is supposed to be campaign to run from the digital marketing department based on your data. That also is going to help to improve your and boost your business. Bias of customer, of course, there is a if you're talking about the enterprise solution, then there will be a net promoter score inbuilt into that, and if any detractors NPS perspective comes, then the hospital takes the precaution in runtime, or they can take a historic data and then start working on those departments from where these detractors for the NPS has been recorded. And this is the way the analytics is going to help in terms of the healthcare industry, healthcare fraternity, for the patient and for the organization, to ensure that hospital is doing good, and their patient who are connected with them, they are being benefited. So I was just talking about that the market size of the business intelligence component in terms of product, in terms of services. So if you'll see this graph, software, the existing software, the legacy software, the people are adding this component to make more robust, so that their clinical adoption can be much easier for them. And then if the clinical adoption is much easier, then the hospital will be benefited. And in terms of services in the sense that the set of data will be there, and on top of it, they are going to take a BI component and run the BI component on top of it, and look for a certain outcome to take the action. This is all about from my side. I hope that what we discuss is make a sense to the patient and the healthcare organization. Thank you very much. Thanks for joining this webinar. Thanks a lot.
Well, what a wonderful, insightful session that was, Mr. Abdullah. I'm sure our audience and viewers will have a lot to learn from it. Thank you so much for associating with us for our healthcare series, and we look forward to more similar informative chapters from you, focusing on analytics and digitization in the healthcare arena. For our viewers, I hope you enjoyed the session as much as we enjoyed putting it together. For any queries to Mr. Abdullah and feedback, we are inserting a form in the comment section. Feel free to drop your questions there, and we'll keep you apprised for the next webinar chapter. Follow us on LinkedIn for more updates. Once again, thank you all. Enjoy your day.